Hello, this is Dr. Do again. This video is still on alphabetic list problem, still on letter P. Today I'm going to talk about not a particular disease, but is a general concept, clinical-oriented concept. It's called prognosis of diseases. How to expect if somebody is getting ill, either your family or yourself, what kind of consequence or the final outcome. So this is really depends. It's really multiple dimensional concept. It's not and also individualized. For example, the same person, the same disease, hypertension, occurred in different people. The prognosis is different because if you consider every individual as a whole organism, the cells, like I previously mentioned, the same cells in this body is different from in the other one. But the prognosis, so basically all the diseases actually, if you think about it clinical-wise, clinical manifestation or clinical causes, basically you can divide it into like either autoimmune cause or inflammatory or infectious or cancerous. Of course, injury is different category. So this is basically about the disease, non-injury caused disease. And somebody probably arguing, what about the genetic disease? Actually, genetic disease is eventually will fall into this four category. For example, the genetic disease either from the gene mutation or inherited disease, but the clinical presentation, clinical course, either falling into genetic disease caused the inflammation or autoimmune or the cancerous or so this is probably or increase the risk of infection. So I think this four major categories pretty much covered all the clinical course of the diseases. In terms of the prognosis, usually, for example, the etiology, I talk about the cause of these four major categories. In terms of time, either chronic or acute or subacute, chronic, subacute or acute. Usually, in general speaking, in many cases, acute diseases has a better prognosis compared to the chronic disease. For example, the acute glomerulonephritis or acute pyelonephritis compared to the chronic kidney disease, chronic nephrology caused by the other systemic disease. So the acute cause usually has a better prognosis. The same idea, acute arthritis, for example, usually caused by the viral infection or bacterial infection or acute injury, and then treated accordingly. Usually, some majority of case will recover, but some of them may become chronic. So that is the time really. It's difficult to manage. A lot of time, the chronic disease is really challenging for the patient to deal with daily pain or daily problems. Also for the physicians to deal with this chronic diseases without obvious better outcome. For example, acute appendicitis. That's the excitement part of the surgery for the surgeons. The patient come here very ill, lower abdominal pain, fever, nausea, vomiting, and look very ill. And the surgery probably I think nowadays 30 to an hour or so is done, and the patient recovered next day or the couple days later just as normal. So this is about acute diseases. The same idea like acute bronchitis compared to chronic bronchitis. The outcome is way better because, of course, even though some of the acute bronchitis, if not treated very well or if not finished the antibiotics whole course, then will turn into chronic. But in general, this is general. Of course, there's always some exceptions. But this is in general, the acute diseases has a better prognosis compared to the chronic. In terms of etiology, usually the infectious disease, especially nowadays because of the immunization, because of antibiotics so available, a lot of times the infectious disease probably is, except for the immunodeficiency viral infection, other than that, and also patient with chronic conditions or elderly, in general population for health, young people or middle age or late adult, the infectious disease probably is not the worst. It's kind of easy to manage, and the cause usually is acute. So acute pneumonia, for example, in late adulthood, even though it's the age probably beyond 50, had many risk factors, but if patient has been healthy without hypertension, without diabetes, without any comorbidities, so the treatment is probably 2 weeks or 3 weeks is recovered. However, if the chronic lung disease like COPD, it is just going on and on and on. It's basically non-curable. The acute disease, you can talk, when you talk about the HEAL, really refer to those acute, like I said, acute pancreatitis, for example, acute cholecystitis, take it out and then everybody is happy. The really healing is referring to this for the chronic disease pretty much. I cannot think any chronic disease can be healable. Just maintain of the, in the remedy, use the remedy to maintain not flaring up or to maintain daily function. But the disease is still there. The treatment usually is symptomatic. So this is in terms of, for example, I'll give you some examples like rheumatoid arthritis. It is a chronic process, probably diagnosed at early stage. After the diagnosis, pretty much the purpose or the goal for management, for treatment, is to slow down the progress and to decrease the clinical symptoms, decrease the pain, and decrease the complications. So this is about but not, the HEAL is not here. So the healed disease is not there. It's just not going to happen. Only just getting worse with the time, or maintain. If not getting worse, that's the purpose of the treatment. And so this is about another example for the chronic kidney disease. Eventually, there's no heal. Don't think about the chronic kidney disease can be healed. The nephropathy, if it's acute, in young people, acute nephropathy usually can recover fully. Majority of cases, there's some cases cannot recover. And for those long-term, long-going chronic kidney disease, regardless of the cause, really the HEAL is not applicable. Just like I said, to treat, symptomatically treat, and slow down the progress, and decrease the complications, and maintain daily function. And this applies to probably all the organ diseases or systemic diseases. So I just divide into this 4 categories. So in general, really the infectious disease or inflammatory disease or autoimmune disease or the cancerous. So I already mentioned, probably if the infectious disease has the better prognosis, in general speaking. Of course, there's some exceptions. I already mentioned human immunodeficiency virus infection is also a chronic process, and also hepatitis, some viral infections. But like I said, if without any systemic disease like pneumonia in healthy late adult, or so it's still healable, treatable. So this is about the prognosis in general, give you some idea. And also the last point is individualized. Different people, the same disease occurring in different people, the consequence, the prognosis is also different. So I'm going to stop here and hope just give you some idea about what a disease are, what are those terminology, and in terms of prognosis. And I hope it helps. And thank you for watching. I will see you next time.